Hold on one second. We're waiting for the whole system to reboot. Yes, I can hear you. Can you hear me? Oh. Deji, you're sabotaging us, man. Hi.
Hi, Farhan.
Nice to hear you. And this time, all of us in the room can hear you again, so that's great. Sorry about the kerfuffle. And ladies and gentlemen, I would like yet again, once more, to introduce Dominic Allen, the country representative of the UN Population Fund for the State of Palestine.
Hi, Dominic. This is De Zhishu with China Central Television. Actually, I have two questions. You mentioned several hospitals during your visit there. For example, Emirati Hospital in Rafah. Earlier this month, this location just being bombed by Israeli IDF, accusing that terrorists were there. During your visit, what do you see of those hospitals? Are they like the location for terrorists? And I guess the next question comes up with this one is, do you fear that if there's no ceasefire, all those hospitals you mentioned, they might have the chance to be second bombed again? I mean, would that be destructive for a already dire situation? Thank you.
Yeah, when I visited the Emirati hospital in January, it's a hospital that we have, together with the World Health Organization and UNICEF, have supported over a number of years to improve maternal health services. And I can tell you that what I saw at the time was consistent with what I saw this week as well, is that this is a hospital at breaking point. The delivery rooms that I went into, the medical stores, the emergency cases that they're dealing with are overburdened. There are 5 delivery rooms in the Emirati hospital, and one of the midwives that we managed to grab 2 minutes of her time because the staff is so overwhelmed with these nearly 70 births, 70 regular births and 10 to 12 C-sections. They are so overburdened that these delivery rooms, in the rotations that they have with the women who are in their last stages of birth, one midwife reported one woman giving birth on the floor. So what I saw from Emirati was not only the birthing suites, the emergency part of the hospital, witnessing nearly 400 cases, which they can't admit all of those cases. And as I said, the supplies that are moving through at such pace, the UNFPA supplies and those of other health partners are barely touching the ground. So that's what I saw when I was at Emirati Hospital. On the second question, indeed, we're deeply alarmed by the frequency and ferocity of attacks that have been on healthcare facilities and services, because as I keep saying, and you've heard consistently from Dr. Tedros, from the World Health Organization, from UNFPA, from our executive director, Natalia Kanem, and others, the healthcare system in Gaza has been decimated. And these hospitals, ambulances, healthcare workers, patients, pregnant women, the wounded, the sick, they are not a target. And indeed, I am, and this is where as I've said, I'm deeply worried about the pregnant women and the births that will continue to come, because it's for sure that the pregnant women, 180 every single day, what would happen if Emirati was no longer functioning? The capacities that would be needed and the shortages of those access to services could be catastrophic for those women and newborns.